Insumate Patent Sequence 19 peptide helps blood sugar regulation and prevent body fat formation. Modern people are afflicted with their habit of eating disorder and lack of exercise, which cause serious obesity problems and diabetes. Ranked among the top 10 causes of death, diabetes is a fierce killer of modern people. According to a study by the WHO in 2016, 40% of the world population are overweight, with citizens of China and the USA having the highest proportion. The obesity rate of Taiwan ranks among the top in Asia. Moreover, many people living in emerging markets such as Malaysia, Indonesia, and Singapore are also suffering from obesity, where over 24% of the populations are overweight. The high obesity proportion in these areas is also a major cause for the high local diabetes rates. China is a country with the largest number of diabetes cases, followed by India and the US. There are 114 million Chinese people suffering from this disease. In Taiwan, there are 2.3 million citizens suffering from diabetes too. And over 60% of the dialysis populations are caused by diabetes. With the growing number of diabetes patients, governments around the world are struggling to prevent and control this disease. The cause of diabetes mellitus, DM, is due to the inability of making or utilizing insulin, causing metabolic disorders and rendering chronic hyperglycemia. Insulin is a hormone produced by the pancreatic islet cells, namely the beta cells, and it will bind to the insulin receptor if blood sugar levels rise, acting like the key to a door. This key can open the door of the GLUT4 glucose transporter, allowing glucose to enter for energy generation. There are two types of diabetes. The classification is based on the causes of the inability. Congenital issues, autoimmune diseases, or virus infection may cause type 1 diabetes, which leads to secretion problems of insulin. Genetic issues, eating disorders, obesity, or mental stress may cause type 2, which leads to insulin resistance, rendering the insulin unable to bind to the insulin receptor. Due to insulin resistance, patients' bodies have to secrete more insulin, and this reaction process requests the islet cells to overwork, leading to the death of those cells. After that, the secretion of insulin is not enough. 98% of diabetes cases belong to type 2. Normally, the incidence rate of type 2 occurs mostly in middle-aged and elder people. Meanwhile, young people are not immune to this disease due to their eating disorders and corresponding obesity issues. The number of young diabetes patients is growing and has already exceeded the population of type 1 patients. The best treatments for diabetes are 3: diet, exercise, and taking medicine on time. However, many patients may be tempted by certain foods and not cultivate the habit of exercise. Simply relying on medicines, patients' conditions would be aggravated because their islet cells are overworking. Greenyn has been working with authoritative medical schools in Taiwan for over 12 years. Together we have conducted tens of thousands of studies on natural resources in order to find the appropriate substance that can activate the insulin receptor. Greenyn's R&D team is full of experts with PhD degrees in medical science, and through those studies, they found the way to extract the peptide 19 patent Insumate via the sequencing technology. Insumate can be used as materials of molecularly targeted therapy for diabetes, activating the insulin receptor and opening the GLUT4 transporter for the blood sugar. Insumate is effective for both type 1 and type 2 diabetes in sugar control. This patented technology is the one and only natural material in the world that can bind insulin to the insulin receptor and can reduce body fat as well as improve body shape. Besides its therapeutic effects, Insumate can also inhibit potential occurrences of diabetes. Experimental results have shown Insumate can reduce postprandial blood sugar by 53%, glycated hemoglobin HbA1c by 34%, and common diabetes eye diseases by 50%. Besides, the Insumate can reduce body fat formation by 28%, blood triglyceride by 39%, blood cholesterol by 36% via the mechanism of gene regulation. Moreover, it can further enhance muscle synthesis process, inhibiting the liver fat deposition process. This sequencing technology can reduce visceral fat, enhance body shape, and consolidate muscle tightness. Aside from these preventive effects, it has been proven by clinical experiments that with the addition of Insumate, the fasting blood glucose of diabetes patients can be improved by 245%, and the difference of glycated hemoglobin can be improved by up to 600%. The experiment was conducted in the Zhongshan Medical University Hospital with a double-blind study, and the subjects were diabetes patients whose blood sugar levels had no significant improvement, even if they had received health care and had taken over 3 types of hypoglycemic drugs. As a result, the medical effect of Insumate reaches the level of clinical medication. In another experiment, there are 142 chronic patients whose blood glucose could not be controlled well by their prescriptions. Greenyn provided the oral intake of Insumate to them for 3 months. Compared with the untreated group, the fasting blood glucose level and the glycosylated hemoglobin of the treated group were significantly improved by 70%. Those subjects admitted that, as diabetes patients, the intake of Insumate helped improve the quality of their lives. The sequencing technology of Insumate has registered over 10 patents in the EU, USA, Japan, Taiwan, France, UK, Germany, Italy, and Switzerland. Furthermore, it has won awards at the 3 Classic Invention Awards held in Pittsburgh, USA, Nuremberg, Germany, and Geneva, Switzerland, and was awarded the Iran Award. In Taiwan, it has won the Taiwan Biotechnology Award, Patent Technology Gold Award, and Chinese First Brand Biotech Food Award. Furthermore, Insumate has been mentioned in authoritative journals Agriculture and Food Chemistry and Food Chemistry as the one and only natural material for molecularly targeted therapy. In addition, Greenyn's production center has received TQF, FSSC 22000, ISO 22000, HACCP, and Halal certifications, demonstrating that Greenyn's production plant meets global demand for food safety standards and is in line with international buyers' high-spec requirements. With the endeavors of Greenyn's R&D team, Insumate has been used in capsules, instant powders, ingots, liquid drinks, biscuits, and other popular dosage forms throughout world biotechnology markets, including Taiwan, China, Japan, Europe, and Southeast Asia. The R&D team of Greenyn is full of talents with master's and doctor's degrees, and their efforts indeed improve patients' quality of life. Looking ahead, Greenyn will continue to conduct innovative R&D and new drug development to provide diabetes patients with a full range of therapy, bringing hope to them as well as their family.